welcome back to VNA Today. I am your host, David Miranda, and colorectal cancer is the third leading cause of death from cancer in the US. An important fact to know is that this cancer can be prevented. Here's what you can do to keep your health on track.
Colorectal cancer actually depends on where it starts. It could start in the colon, which will be named colon cancer, or in the rectal. So if it is rectal, it can be called rectal cancer. So based on where it derives from is what it's called. So you can actually have them both. And they both commonly have the same features, so they usually call them colorectal cancer. So there's a couple of ways to get screened. One of them is actually a FIT test, which is done at home, which is a home screen test that you actually are checking your stool at home, and then we send it out to get tested. This is our FIT test that is actually given to you. It has got a couple of things. First of all, it's instructions, very easy to read, and you can actually see how to do. And one of the important things is make sure you get the label here with your name and your birth date, which is ideal and important. We actually have a paper that actually the collection paper, and you want to put that in the sample. This is a collection paper, and you want to actually have that out, and you want to open it. Make sure before when you have the stool. Once you actually have the stool, you want to get a location of the stool in different areas. Put it back in here and make sure you place it into the bag with your name on it. And then now we can put it in the envelope and send it out. The other one is a colonoscopy test as well, and that one actually you go with a doctor and they actually do a whole test at you at a clinic. A way to keep your risk down is actually to start with your eating habits, making sure you have fiber, a lot of fiber, your cereals to have a lot of fiber as well, and also try to avoid alcohol. That's not good. One thing that does help is having vitamin C and vitamin D. That's actually very helpful to avoid having any complications with that. One of the things that is important to know if you're at risk is actually to look at your history. If you have a family history, that's very important. Otherwise, if you have any diseases of bowel inflammatory diseases, that's something that also will put you more at risk. You can start getting screened at the age of 45. You may have some doubts that there's something abnormal. If your stool is actually changed and it doesn't look like what it used to, and you're starting to have black tarry stools, you can have some upper bleeding, some GI bleeding, and that can be caused due to some cancers. So it's always important to, if you have any doubt, to make sure you get checked. Anything that's not normal, that you've had your stool, a lot of changes, definitely always get checked. If your colorectal test comes out positive, we do ask you to come to the VNA, and we actually have collaboration with different organizations, Rush Medical Center and Waterford Place. Together we will work with our patients to make sure that we meet their medical needs and any other support that they may have. So that way we can help guide our patients to what needs to be, what services need to be served for them. It's easy to make an appointment with the VNA. You can always go online. Otherwise, you can call us at the 630-892-4355.
That is why it's extremely important to get your yearly checkups. And just a friendly reminder, VNA offers COVID-19 vaccinations for all individuals that qualify, with or without insurance, first, second, and third doses, and the booster vaccine as well. COVID-19 testing services and treatment are also available. Just visit vnahealth.com for location and hours. You can get all this valuable information on our social media. You can go to Instagram or Facebook. You can find us at VNA Healthcare, or if not, on our website, which is vnahealth.com. I am David Miranda, and see you in the next episode of VNA Today.